Today, so we have several speakers here for you, and we promise to give you lots of information, but you're here because you're hopeful to learn some more information about how we can serve you and your employees at your workplace, and we'll have lots of people speaking. We have sort of what you might call a trifecta of services. Everybody, hopefully, if you don't know where our Memorial Suite is on 2nd Avenue, right across from IGA, we do have several service lines that live within that building. We've got our employer services, what we call Memorial Health Employer Services. We do also have our Memorial Rehabilitation Services there, and then also most recently then our new orthopedic surgeon, Dr. Christine Stairs, and her group as well. So that may seem, like happenstance, but it was really very deliberate by design. We wanted all of those folks in one building because they're able to work to serve you and your employees, whether it is a work comp need, whether it is an orthopedic injury that we have, an associate of yours. So that is what we are hoping to share a little bit more with you all today. And my name is Meredith Vogel, and Sarah Maddox and I, we both work in a business development role here at Memorial Hospital. So today you have three different speakers. I've already mentioned Susan, or I've mentioned a little bit about what she's going to be talking about. Susan Weissite. She's one of our directors of medical practice management here at the hospital, and she does have charge over our employer services and actually our health and wellness department. Some of you may recognize her from that. And she actually also has some additional clinics as well. But the two ladies that I have not yet mentioned and what you're going to be hearing about today, Suzanne Burgess, one of our directors here at the hospital in orthopedics, and she also has brought Kendra with her, our clinical manager of post-surgical services, and the piece that they're going to be presenting on is our new rapid recovery program for orthopedics here at the hospital. So.
I'm Susan Weissite, one of our directors of medical practice management, and she shared with you I have oversight of Memorial Health Employer Services. So our Memorial Hospital employer team, some of you may have met this team. We've been doing some employer tours, but if you haven't, we have Daniel Hedinger there, who was just here. We have Dr. Christine Stairs in the white lab coat. She's our new employed orthopedic surgeon. Kim Yoakum in the blue t-shirt, and then Colton in the lime green t-shirt, and then the two on the right, Jeanette Elliott and Casey Crodel. So those are our occupational and physical therapists. Okay, go into a little bit of detail about these. So we've streamlined and really tried to make a collaborative workers' compensation team. Meredith mentioned our trifecta. Those are the three departments that are housed at our 695 West 2nd Street location. And Memorial Health Services, Memorial Health Employer Services in Suite A1, they're at the front of the building. And then Memorial Orthopedic Associates in Suite A2 at the front of the building, but to the right. And then we have our Memorial Rehabilitation Services, which is in Suite D, back on the right side of the building as you're facing the building. So we really feel fortunate that we're able to house all three of these service lines in the same building. And what that does is that really helps us accommodate sometimes same-day services or consultations or referrals. So you may have an employee that comes into Memorial Health Employer Services and they need a consultation with Dr. Stairs, or they need referral to rehab. So we've really been able to improve the communication by having all three of those services located in the same building. The other thing we'll talk about is a workers' compensation business card. You have a copy of that in front of you, and an email that we set up for more streamlined communication between you and our teams. And a standardized medical authorization form. You have a copy of that in your packet too, and I'll go into a little bit more detail about that. And then we'll be talking a little bit about our services through the emergency department, our Huntingburg Urgent Care location, and outpatient lab. And then, as I mentioned, we've been taking our team of Dr. Stairs and Daniel, and Meredith has been going with us, and then sometimes Jill Ashley or one of the therapists, and Jordan or Jill Kidwell, who's the director over the Memorial Orthopedic Associates Department. And we've been touring local employers so that Dan and Dr. Stairs can get an idea of the types of injuries that you might have at your company, and that really gives them a chance to understand what kind of injuries they'll see in the practice, and then also just be able to have a conversation between exactly what you need and what you need and what we can do for you and how we can serve you better. An example of this would be if you have no way to accommodate a light duty individual, which I don't know of an employer yet that couldn't do that, but just understanding those types of things. Like if an employee comes in with an injury, instead of placing them on restrictions, you would say, we can accommodate all kinds of light duty. We can put them at a desk and have them stuff envelopes or have them file or whatever that might be. So those kinds of conversations are what we've been having when we are going on these tours, to give Dan and Dr. Stairs some more information about your company. So this is a picture of Memorial Health Employer Services, Suite A1 and A2 there at the front entrance. And most of you know this, but if not, if you're not familiar with this practice, we do provide workers' compensation management. We have same-day treatment of injuries, and we can accommodate walk-in injuries, so you don't necessarily have to call ahead, although we'd like you to call ahead. That way you are letting us know that the employee is authorized to be seen and treated for that injury. And then we can be prepared when the employee walks in. But if you, for some reason, aren't able to place the phone call, we do accept walk-in. We've also worked to provide a follow-up call back to you, to the company, to make appropriate accommodations, as I mentioned. We can also communicate with the insurance carriers or the third-party administrators. And we emphasize a return-to-work treatment program for our patients. So we know you want those employees back quickly, and we want them to get back to work too. So again, anytime that you're able to work with a modification or accommodation or a light duty, we can definitely work with that. And we've modified our hours a little bit. So this was another thing that we have heard. When we combined our worksite clinic, which was called WorkWell, and IMED, we adjusted the hours, but we heard from employers that our start times weren't the same and that it was confusing for some of their employees coming in. So we adjusted the start times Monday through Friday so that we now open at 7:30 every morning. So Mondays and Wednesdays, 7:30 to 5:30, Tuesdays and Thursdays, 7:30 to 4, and then Fridays, 7:30 to 12. And then additional services that we offer at Memorial Health Employer Services, we have drug and breath alcohol screenings. We can do random post-accident or just cause, job-related immunizations, pre-employment physicals, and drug screens for pre-employment. And then again, of course, the referrals to the specialist for case management. We also can refer to the provider of your choice. So if your insurance company prefers you to refer to Dr. Stairs, for example, we can make those referrals and really work with you to make it streamlined to what you need as a company. Hearing, vision, and pulmonary function testing. We also do some medical surveillance exams. And then, again, back to the collaboration with Memorial Orthopedic Associates and Memorial Rehabilitation Services. So Dr. Christine Stairs actually just joined us. So she is our new orthopedic surgeon. She received her medical degree at Indiana University, completed a residency in orthopedic surgery at Louisiana State University, and then a sports medicine fellowship at UK. Specializes in general orthopedics, which includes wrist, elbow, shoulder injuries, and knee and hip injuries. And then she also has workers' comp experience. She is able to do causation and PPI and MMI. And then we'll talk a little bit about Memorial Rehabilitation Services. And again, we have Jill and Ashley here for that team. Their team includes physical therapy, occupational therapy, and speech therapy. And their PT and OT caregivers, they provide early intervention and preventative services, and those are the on-site services. And then they can also do ergonomic assessments. They do workers' compensation, evaluation, and treatments, and work conditioning if required after a provider would order therapy. Functional capacity evaluations if you need that for return to work. So the other thing that we developed after this team came together was the workers' comp business card and email. So we heard from a lot of employers that they wanted a more easy way, a more efficient way to get information to us, and a more efficient way to receive information from us. That workers' comp email, workerscomp@mhhcc.org. So we're able to receive the medical authorization form that way. If you have questions, you can email it in. We get it to the right staff, and it comes to a shared email so that our team has all access to that.
Hello, everybody. I am Suzanne Burgess, and I am absolutely thrilled to be with all of you. I am the Orthopedic Program Director at Memorial Hospital. I wear a couple other hats, but today I'm your orthopedic program director. I have with me Kendra Rote, and she is my fabulous clinical manager on post-surgical. We've been listening, and we listened to our younger, healthier, more active patients, and they kept telling us they want a quicker path to being pain-free. And so we took that to heart. And we at Memorial Hospital in our Orthopedic Center of Excellence created a program just for them. We recognize that these patients want an option to not only recover quickly, but they want to recover at home, because they've realized that there are many benefits to recovering at home. And so this program really helps them, and it's again, this patient population, they're the ones who believe that replacing a painful knee or hip is basic health maintenance. It's not an illness. They want to get back to what they love to do. So we're going to tell you a little bit about it. So that's a little bit on the why of a basic rapid recovery. The most important thing is they are up walking hours after surgery. Literally, they come to the post-surgical unit, and within an hour or two, they are up walking. Jill's team in the hospital is working hard with them. So that's a different piece to Memorial's Rapid Recovery Program than other quicker programs that our area has, perhaps a surgery center per se. These patients still come up to the post-surgical unit, and they still have the skill set of physical therapists working with them, as well as the post-surgical nurses are working. But they are up walking within hours. They are back in the comfort of their home, literally 4 to 6 hours after surgery. And it's okay if it takes them a little bit longer, but they know up front their goal is to get back home, and they're realizing the benefits, and I'll show you that in just a minute. These patients recognize that they have less risk of nausea, blood clots, and infection after surgery because they're in their own home. But we've tried to really anticipate any post-op complications or concerns that the patient or their coach may have, and we've created tools. So why would a patient be successful? This was one of the questions, and you all were spot on. They have to be motivated. But I'm telling you, more and more and more of our patients are coming to us. They're engaged, they're motivated, they want to start the recovery program before surgery, and that's the ticket. There is so much we do. We really front load before surgery, so after surgery it's a whole lot quicker. We've also recognized the importance of having that dedicated, very engaged coach. And it really doesn't matter who the coach is. It doesn't have to be a spouse. We have neighbors that are coaches, we have children that are coaches. Whomever has to walk with the patient, journey with the patient before surgery and after surgery. That makes a huge difference. So why Memorial Hospital? We're the only place that has this program. We have spent months actually working on every step of the program. We've involved our anesthesia team, we've involved our internal medicine, our surgeons, physical therapy, occupational therapy, and then the post-op recovery on post-surge. We've looked at every person that will be touching the patient. That's part of the orthopedic team that we're talking about, and you're not going to find that anywhere else in our area. We want to make sure that even if the patient goes home that same first evening of surgery, they have that safety net. It's someone available to take their calls 24/7. Doesn't matter when they call, there is always someone available who is skilled in caring for orthopedic patients, available by phone. This free smartphone app, it's so cool. It's called My Mobility, and again, we're the only place in our area that has My Mobility to really walk a patient through before surgery and then the recovery. And that last statement is our orthopedic nurse navigators. I want to introduce you to our 2 nurse navigators. They will journey with the patient from the beginning when they're even thinking about having a total joint replacement all the way through to weeks after surgery. They're the contact who is involved with anesthesia. They're the contact with the post-surgical nurses. They're the contact with the patient and their coach. You'll get very familiar with these 2 nurses.
So Suzanne mentioned My Mobility. So we just wanted to show you some of the cool things that we can offer patients when they come through our Rapid Recovery program. Truly our team, we've had tools for a long time, and we recognize though very quickly, early in the progress and in the early stages of our program, that we need to make sure we tweak and adapt our tools to really fit this population. So one of the tools that Suzanne mentioned was this My Mobility. It is a free smartphone app, and this little watch over here is, we also provide a watch for those who have iPhones, and so they can use their app on their phone on their watch as well. But don't worry, if you're not an iPhone user like myself, I'm an Android user, you can still use the app on your phone and still get the same benefits. Patients really do enjoy using it. Everybody uses technology these days, so it's been very nice. So that is My Mobility. Suzanne also mentioned one of the keys to a successful rapid recovery joint replacement is the coach. And she's exactly right. They need that support. Somebody who's heard the education, understands you've got to have that support. So previously, we did not have a specific guide for our coaches. So we've really focused on making sure that we've deemed somebody specific to be the coach, and we've given them this brochure or guide to really help our coaches out too, because we've really recognized the importance of the role that they play.
Questions. As we finish up, we just wanted to share some patient testimonies. Obviously, I'm not going to read all of these, but I did want to point out a couple. The very first one on the left, this gentleman actually goes from hospital to hospital, and he does process improvement. And when he went through our pre-assessment, he said, "You guys are the best I've ever seen." And then the one on the bottom far right, he was able to mow his yard. That's what he wanted to do again. You know, when we talk about how quickly will you get back to doing what you love, it is. It's 3 to 5 weeks. Now, they may not be getting back to work in 3 to 5 weeks, but they're getting back to what they missed doing. And that's the point that we really want to stress. And I know we call every one of these patients, and it's consistent over and over. It's just not a one-timer. And this gentleman, he was a little scared, but he knew he was in good hands. And he was back in his recliner by 5 o'clock that same day of surgery. That meant a lot to him.